Good day, viewers. Welcome to another edition of 30 Minutes, the interactive program of Trust Television. With me today is Dr. Mohammed Gana, the Commissioner of Health of Yobe State. Dr. Mohammed Gana, welcome to the program.
Thank you very much. Yeah.
I mean, Yobe State is on the front line of the northeastern insurgency. Indeed, the previous insurgency started within Yobe State, not in actually Borno State. How has that been a challenge to your mandate of delivering health care to citizens of the state?
Thank you very much. As we all know, insurgencies actually are a barrier to, delivering services to populations, primarily because of the insecurity it causes. There's some stability that is needed to be able to deliver. But then, despite all that, the state has been resilient enough to be able to, despite the delays, but then is able to do its best towards providing those services. The government has provided all the support that is necessary over time. And by virtue of the fact that the health sector is a priority of the successive governments before the government of His Excellency Alhaji Ibrahim Gaidam, and then when His Excellency, the current governor of the state, Honorable Mayor Malabuni, assumed leadership, what he chose as his mantra was consolidation, continuity, and innovation. So basically, because of that continuity and everything, the system continued. The other thing is that the work that our security agencies have done in curbing and controlling the crisis actually, freed a large portion of the state. As it is right now, where we may probably say we have problems is around the fringes of the states, the local governments that are bordering.
Yes. Is it Yusufari?
Around Gaidam, Mafa axis, and then of course some parts, just little parts of Gujuba that is around Dambwa areas. But even with that, a lot of control has been achieved. So, but then as a sector, the resilience of the health workers as well. Basically, even at the height of the crisis, what the health workers used to do is they will continue providing the services. Sometimes they may have to have some reasons to withdraw, when the whole thing hits up. So they will have to withdraw for some time, but then yet because of that resilience, they get to go back. So that commitment really also really helped in, sustaining the services. I think by and large, these are some of the things that, helped out.
But personally, what prepared you for being the Commissioner of Health in the state? Were you a civil servant within the state, or were you working elsewhere before you got into that post?
Initially, Yobe State government, since the early 90s, supports its medical students. So when I was a medical student, actually I benefited from the support that the state government gives its medical students to encourage them to study medicine. So after that, I wasn't able to go back to serve, but then I went straight to do my residency training. From there, I joined the services of international partners, working with Pathfinder International, the Family Health International, and then I worked with the U.S. Department of Defense Walter Reed program under the U.S. Embassy. But then, having worked with those organizations since 2003, since around 2003, I noticed that there was a need for me to go back and contribute my own quota, seeing that our indices, are on the low side. So it doesn't make sense to sit and lament
Actually, that's the point I wanted to
so
say, that organizations like the ones you mentioned,
yes,
Pathfinder and other international organizations,
exactly. So,
are always showing us the very poor state of health in states like Yobe. So you sat up and said,
yes,
let me go and pick
so
the
I
ball
felt that, so that responsibility, one, of course, I didn't serve my bond. I felt that was not a good thing. But then the second most important thing was having gained exposure to the partners and everything, and then of course the skill sets that we acquired. I decided to go back to the state around 2012. Then His Excellency, the former governor, approved for my engagement as a director. So I was a director of public health for about 7 years before I was appointed as an executive secretary of the primary healthcare agency. When His Excellency, the current governor of the state, Honorable Member Labuni, assumed mantle of leadership, he did see something in me, and of course he found me worthy to come and serve under his cabinet, and then here we are, the Commissioner of Health.
So in all these progressive posts that you've held, from director to executive director to now commissioner, what will you say is the single biggest health challenge of Yobe State, and by extension that general area of the Northeast?
You see, the challenge basically is around the health system in general. The state has done a lot in terms of improving on healthcare services and so on through programs and etc. But then it was on the platform it was quite fragile. In the sense that the system, as per the pillars and everything, they were quite weak.
Institutional decay.
Yes, so that has affected the system. So with that, of course, that exposed or opened up the challenges. First of all, of course, we had challenges primarily around maternal and child health services, where, of course, the uptake of antenatal care services, labor and delivery, immunization services were on the low side.
Is Yobe State one of the worst? Because I see states from the north at the bottom of the pile.
Pre-2018, yes, the state was amongst the lowest, had the lowest indices. But after that, there was this rapid increase in the indices. For instance, in 2015, the Penta 3 coverage was around 9%.
What does that mean?
That is the pentavalent vaccination coverage. That's the pentavalent vaccination is a vaccine that is given to children to protect them against diseases such as the whooping cough, pertussis, and so on. There are about 5 vaccines in one vaccine. It is the marker to show the uptake of vaccination, because It's expected that you start giving the first pentavalent at 6 weeks, and then at 10 weeks and 14 weeks. After that, there is no other vaccine the child receives except until the child reaches 9 months of age. So usually that pentavalent 3 is a marker to show that a child is actually is up to date with their vaccination.
So Yobe State is
up. Yes, so Yobe State rose from 9% to 65%. The multiple indicator cluster survey of 2015 showed that we were at 9%, but the recent one that was done in 2021 revealed that we rose to about 65%. So that goes to show that at least from one of the lowest states, at least we've come to be one of the highest. And is
that been sustained?
Yes,
or it improved
is. Yeah, the improvement has been sequential. When you look at in 2015, it was 9%. Another survey was done in the SMART survey was done in 2018. It showed that we rose to about, I think about, 50-something%. The NDHS was done, although that brought it down to around 29%. But then having this mixed NICS survey it showed that we were at 65%. So basically, you can see that there is this consistent improvement in the uptake of the penta vaccination.
And has this got anything to do with the declaration in 2013 or so of a health emergency in the state?
Yes, it has. In 2014, the former government actually declared a state of emergency in the health sector. And that declaration of a state of emergency, culminated into massive improvement in infrastructure, realignment of the human resource, and also more monitoring and supervision of the system. It also, brought up the attention of those that are managers of the system, because it's just like an exam. Whatever it is that you do, these surveys, we look at them as the exam. When whatever you do, you implement interventions, at the end of the day, if you do not improve, that actually shows that there is a problem with the interventions or they are not optimal. So when these surveys are done and you see improvement, at least you know that what you're doing at least is actually in order. So that has really helped in us in bringing the attention of the system towards improving on the uptake of services.
What about the big maternal unit that was to be constructed, I think some years back? I recall some reports suggesting several billions to be spent to make it like a state of the art is usually claimed. Is it completed?
Yes, that building as it is, we can say that is one of the largest, or not, if not the largest in the country. It is around 95% completed. Already we are looking at equipping, and hopefully by April, May, we expect the project will be commissioned by then.
What about the big issue of personnel? You yourself did say you were trained by the state, you went elsewhere. Are Yobe indigents prepared to stay in those kind of state-of-the-art places where, they could practice their craft?
You see, the circumstances during our own time are quite different now. As it is, government has really since the declaration of emergency, human resource for health has been a center stage. And there has been these systems of attracting and retaining health manpower. The state has always, encouraged its citizens to come and work in the state. And that is why, of course, the sponsorship of over 400 plus students, both in and outside the country. And of course,
these are all medical doctors or medical personnel generally?
They are medical doctors. These are medical doctors. But in addition to that, of course, we have other cadre of medical personnel. For instance, of recent, just about 2 years ago, some students were taken to India, Gokal, to study different health courses. So that, again, with the commensurate improvement in the salary structure, as well as also looking at other forms of motivation, has made our indigents to come back and work. But then, in addition to that, the environment, of course, the government has made the environment friendly for those that are not even indigents to even come and work. For instance, we've employed both locally and also internationally in order to bridge the manpower gap. So we have short, medium, and long-term plans to address that. As per the issue of putting in human resource for health, these in the center, this is something that we are currently really talking, and of course already it's something that we have already discussed, and the government of His Excellency Honorable Member Labuni has always been very receptive to anything that will bring development to the system. And without health, of course, there will be development will not happen. So as such, it's an issue that we are already on top of.
We'll continue with the discussion when we come back on this short break.
Okay.
Viewers, this is 30 minutes, the interactive program of Trust Television. We'll go on a short break now. Welcome back to 30 minutes, the interactive program of Trust Television. My guest today is the Yobe State Commissioner of Health, Dr. Mohammed Gana. Doctor, just before we went on that break, we were talking about the human capacity and all that. I think I saw a report suggesting that there were less than 100 doctors in the whole of the state. I don't know what the exact situation is at the moment.
No, there are more than 100 doctors actually in the state. The postgraduate doctors that we are currently support training in the various teaching hospitals across the country have over 60.
But I'm talking of the ones that
so
are
those
residents and working
those are
in
the
the
residents and
hospitals.
working. There are more than that number. I think they are up to twice that number as it is right now. But obviously, the challenge of human resources is actually an obvious thing. But then is a factor of what the state is doing to solve the problem on the short term, and then of course the medium term. The medium and long term, the state has already started a medical school to train medical doctors.
Under the state
Under
university.
the state university, yes. As we speak, over 120 students are currently on training in that institution.
As medical doctors
As medical doctors to be. This is in addition, like I said, to other universities within the country and outside the country. And then, of course, there are those that are on postgraduate training. Again, the schools of health technology and the College of Nursing, the College of Health Sciences and the College of Nursing have also been repositioned to train additional required manpower. What we have done in Yobe State basically is to look at what cadre do we need to train, because it is the tradition of the state to absorb those that have graduated. So in the College of Health Science, in the College of Nursing and Midwifery as it is, we are running the nursing program, the midwifery courses, and then the community midwifery courses. In addition to now, we're also starting the community nursing programs. In the last 2 years, the government has absorbed over 300 nurses and midwives into the system.
But are these all that have graduated from your schools, or there are some who cannot find employment with the state?
All that have graduated in our schools have actually been engaged, but in addition to that, there are some that have graduated in other institutions.
Who are Yobe indigenous?
Who are Yobe indigenous, yes. In addition to that, the College of Health Sciences, again, we churned out additional courses. Before, we were running just the community health extension and the environmental health programs. But then having looked at the need, especially at the primary healthcare level, to have the various cadres, such as the pharmacy technicians, the laboratory, HMIS, and others. We started those courses around 2019, 2020. Around 2018, 2019.
Right, so with all these things that your state is doing, what is it not lost in the midst of the sea of problems of health in much of northern Nigeria? We haven't even talked about preventable waterborne diseases, malaria, which is caused by mosquitoes, and all others. Do you sometimes feel that not enough is done if it is just limited to your state and it's not elsewhere in the whole region?
You see, the thing is, we've seen various degrees of development that are happening. So the states, when you go to every state, there are some unique things that they are doing in order to improve on the health system.
But is there coordination?
Yes, there is.
Among the states?
Amongst the states, yes. When you look at it, the commissioners of health of the 36 plus 1 states, we have a forum called which is a fully registered forum. and we meet on quarterly basis to rub minds, share ideas. Typically, let me give you an example. In Yobe State, we started this program of supply chain management, established an agency, and then we went into an MOU partnership with private sector manufacturers, the pharmaceutical manufacturers group, and
so that you can get
cheaper medicines and high quality medicines, and then of course to improve our system to reflect the private sector ways of doing business.
And other states have brought into it.
And yes, we've gotten and having shared that that success, up to 5 or more states have keyed in, signed a similar MOU, and they're running that program, and we are coming together to further improve on that and encourage. And we've seen a lot of other states that have shown interest in joining this kind of arrangement. So this is just one example of how we are moving together.
What about this challenge of kidney failure that runs across from Borno, Yobe, into Jigawa, and possibly Kano State? It's been there and it seems to be getting worse. What exactly is your state and possibly the other neighboring states doing about it beyond just having dialysis machines to treat those with the chronic problem?
Yes, this problem, we discovered that a lot of the rate of kidney failure was actually very high in the northern part of the state, around Gashua, Nguru, and some of the local governments around there. But then again, neighboring Jigawa State, I think we discovered it follows this river, the Komadugu-Yobe River basin. So you see it in Hadejia and other places. So
is it to do with water or what?
Yes, I think what we actually did was, we approached it in 3 directions. One, to research and find out the cause, and then to look at prevention, and then of course, whatever it is curative, we have to look at the curative component of that. Under the research, research is something that you need to have this very good collaboration and coordination. So we made a memo to the National Council on Health. The then Minister of Health actually linked us with the National Center for Disease Control. We all came together with institutions like ABU, UNIMED, and others. We actually even went ahead to do some desk reviews because the issue was that we had pockets of research that have taken place, but then none of them actually had worked on the human beings that had the problem. So there were no human components of that, and we felt that there was need for that. The Federal Medical Center in Guru, which is also part of the team, started around some years back, but then they also ran into a roadblock because of the cost of the tests. Only one agency was able to run the test, and it was too expensive for the hospital to run.
So far the research is not conclusive.
We've not really concluded, because we came up with a proposal, we costed, we approached different organizations, and to see how we can raise the funds, because it was actually on a very high side. It was at 2018 or so when we did that proposal. It costed about $500 million to actually run that research to establish the real cost. But
$500 million shouldn't be impossible. I mean, especially given the way it is pauperizing people. You see, even fairly well-to-do people, they just cannot afford the kind of care that is needed. And it's ravaging so many young people in that area.
Yes, actually that is true. But then it's something that is work in progress. It's something that we will continue to pursue to see that research happens.
And the money is available now?
Not yet. But then we are still depending to see how we can raise the funds from the different, different areas. But then we've actually also looked at some of the preliminary studies that have taken place. Some have linked the problem to farming activities. Some have linked the problem to water. You know, it has shown that maybe there is some high levels of some metal, some heavy metals in the water that of course is not compatible with human health. So, but then there is need. What we want to do is to actually look at those that have the kidney failure and measure the level of those heavy metals in their own system. And then, of course, look at those that are still that are yet to develop the problem again, in order to see what is the level, and then also to look at to rule out other issues. Perhaps maybe hypertension, diabetes, maybe more, you know, and you have to document to even say that okay, this is the prevalence of the problem across the state.
And is it only your state that is doing all this, or is it doing it in collaboration with the other affected states and then the national body?
Yes, we actually shared and talked with our neighboring sister state, Jigawa State. In fact, they also actually ran a research. The findings from their own was that you know, there were high levels of some chemicals in the agricultural products, that the agricultural practices, pesticides and so on. And they also linked that to, you know, other farming locations in other countries of the world, that you tend to see more of these cases in those farming, and so maybe it could be linked to the agricultural practices. But then, like I said, for you to firm up that, you will have to actually really carry out the studies with human beings, take some tissue specimens, blood samples, and so on, measure those levels, and then of course then you can say yes, this is actually, so you need to have that causal association.
Thank you very much, Dr. Mohammed Gana. Unfortunately, time is running fast for this edition of the program. Thank you for finding time to be here.
Thank you.
Viewers, we've come to the end of this edition of this program. Thank you.